Thompson, I guess you're right. We've introduced you enough times. I'm not going to say too much. So we appreciate you very much. We look forward to what you have to say.
All right. Thank you, Tim. And thanks all of y'all for being with us. It's been a tumultuous week. I actually went camping last week on Tuesday, so I wouldn't have to listen to any of the political stuff. And I came back on Saturday. We still didn't have a president yet. So I think we're moving in a direction now. But I had a good week last week. Michael, if you can call us up, we'll get started and jump in here. I think we've got some good news, light at the end of the tunnel with some of the vaccine information, but we've got a pretty dark tunnel to get through. We across the whole United States, continue to have what the White House task force defines as uncontrolled spread because of the positivity and transmission that we have. Just hold it here for a second. I think we also have some unfortunate decisions that have had to be made that I want to make sure we do everything that we can not to. The Air Force is sending medical personnel to the field hospital in El Paso because they have surpassed the local healthcare system's capability of staffing the need for that field hospital. The governor of Utah yesterday announced this morning that they are moving into a rationing situation where they are not providing ventilators for everyone who does need a ventilator in the state of Utah. And so they are going into a rationing situation in Utah. That's in addition to some of the effects that they put in place yesterday with limiting of gatherings of anybody outside of your family. You cannot socially gather for any reason in the state of Utah now. They also have, that's through the latter part of November. All school activities are canceled in Utah. If you are on a college campus and attend one class in person, you have to get tested each week. And so those are some of the actions that states that have really lost control of this are having to put into effect. Going forward, we've now crossed, these are the increases. We are that green line that is now again highest in the world. We do see some of the European countries, France in particular, also Germany, are losing some of their control. But as far as the absolute numbers, we're now at 120,000 plus new cases daily. That has pushed us on the next slide beyond 10 million new confirmed cases and over 230,000 deaths. We're at about 1,000 deaths per day. So we really, while we have a light at the end of the tunnel in terms of the Pfizer reported information Monday, we've got a lot of pain that we're still going through now. Nationally, that is also true at the state level, where we've got 120,000 total cases that have been confirmed. The last few days have really been, I think, a significant cause for concern. We've been over 1,000, up to 1,800 cases last week, new cases a day. We were down right around 900 plus yesterday, but of course you remember most clinics and so forth are closed on Saturday and Sunday, so you always have a smaller number on Monday and Tuesday, and it climbs back as we go through the rest of the week. One of the numbers on the next slide that I think is a cause for concern is we're now approaching 800 hospitalized individuals. You may remember earlier when we looked a year ago at the number of people that were in the hospital overnight, it was around 9,000 folks that the Arkansas hospital system all together had about 9,000 folks in the hospital this time a year ago. So we're inching up to where we've got about 10% of all the hospitalizations getting close to being caused by COVID. Of course, that doesn't, we still have heart attacks, we still have strokes, we still have cancer care, we've got all the other demands on the healthcare system. So this is an additional load. We are pushing the number of confirmed deaths to almost 2,000. When we look at our trauma regions, we continue to see the number of active cases go up. You'll remember where we were a couple months ago. Most of our trauma regions were hovering around 1 active case per 1,000 residents. You'll see in that northeastern part where we've had the hot spot, we're up to 6 for active residents. And when we look by region, the trend lines, all of our regions are moving in the wrong direction with consuming more of our daily new cases, and those result in new hospitalizations, new ventilator requirements, and so forth. Our death by age continues to be in that 45 to 75-year-old age group. On the next slide, Michael. Sorry, these are the geographies. The darkest zip codes here have more than 1% of the residents that are actively infected or have new infections there. We've got the top ones over here, the 72365. I don't know exactly which one that is, but it has almost 3% of its population newly infected in the last 2 weeks. And so going forward, Mike, these are the new cases per day, and you see those spikes up into the late last week, over 1,500 new cases a day. I suspect we will be back up at that level later this week, if not higher. That may be in part due to Halloween festivities a week ago. That just shows the continued kind of craftiness of this virus to get among ourselves when we're not thinking about it. When we look at hospitalizations, sorry, these are the deaths by age and hospitalizations. We see the largest number of hospitalizations are in that 45 to 64-year-old age range. The death toll continues to skew towards the older population group. Next. I think we had this on our last call, but I want to put it out. I've heard folks say, well, you know, the flu kills more people than COVID. That's actually not true. We've got, you know, good numbers that it's about 10 times more people so far this year have died of COVID than died last year of flu. And if you go in the hospital with COVID, you've got a 5 times higher risk of succumbing to the COVID infection than you do the influenza infection. Next. Here are hospitalizations. Currently hospitalized, you see that upward trend. On the next slide, I think you've got ventilators. And unfortunately, this is, you know, the almost 2,000 deaths are happening more frequently and at a more rapid pace. On the next slide, you've got the number of deaths reported each day. That 147 mark is when they added the antigen test in as moved them from suspected to counted cases. But we're having 20 to 30 deaths a day being reported from COVID-19. On the next slide is how fast we got to the next 100, and you see we're clipping along here and losing individuals in our families and communities. On the next slide are the excess number of deaths. You know, you had concerns that, well, aren't people coding the deaths that would have happened anyway, COVID deaths? The blue line here is the average number of deaths over the last 5 years. The gray area here is how much variation there was, or the 95% confidence interval. The red line is where we are this year. So you can see we've got about 10% more deaths than usually expected on any given year and point in time. We continue to mark our comorbidities, and those haven't changed much. Immunocompromised individuals, those on high-dose steroids or cancer therapy, kidney failure, congestive heart failure, diabetes. I want you to remember this list on the left, because when we get to our discussion about Thanksgiving festivities, if you've got family members that have any of these conditions, I think you really need to consider how you're going to safeguard them and whether you should have a big Thanksgiving event inclusive of them, how you want to keep them from potentially being exposed, because these are the conditions that lead to poor outcomes and a higher likelihood of death. Now I think the next slide takes us into the school setting. We are, I think, continuing to have schools. We do see on our website, we're tracking schools, and we do see schools where they have in the community kind of lost control and then turned from Mark Tree here, going from green status early in October to now where more than almost 1.5% of the people that live in the school district that Mark Tree draws from are newly infected. That obviously then places risk into the schools and spread among school children. We see that on our map also. This is the next slide is a map of our state back the middle of October. This is on the 12th of October. When we updated it last week, you'll note on the next slide, much less green and more orange and red, and even the addition of purple. So, this is the growth in the spread across our state going forward. We've got 35 school districts now that are in that red zone. We can click through here. The next couple of slides have those. We've also got some colleges that are being reported with active cases. And of course, when you see some of the football celebrations and other things going on, that's not helping us any. So these are the number of colleges across the nation actively reporting cases. The health department reports the number of cases from those colleges. I think this is probably an undercount. I think you probably have more than 100 active cases of the 40,000 plus students there in the Fayetteville area. ASU announced last week that they were going to go all virtual. They were not going to have in-person courses, that it would all be virtual because of the spread that they'd experienced on their campus. When we come to our vaccine tracker, which I think is the treatment updates, so we got convalescent plasma, remdesivir, dexamethasone, and the antibody cocktails. Just yesterday, on the next slide, the FDA provided emergency use authorization. Now that emergency use authorization is not the same as approval. It's just saying that there appears to be the potential for benefit of a monoclonal antibody named, I can't even say the name, bamlanivimab. I don't know how they come up with these names. I think they must take a Scrabble game and just roll all the dice at the same time. This antibody, this is a pharmaceutically made antibody. It doesn't come from a human being, but it has been shown in a randomized trial to be able to reduce the hospitalization and bad outcomes for folks that are at an earlier stage in their disease. So it's for treatment of mild to moderate COVID in adults, pediatric patients. This is approved for pediatrics 12 and older at high risk for progressing. Now, one thing that is a caution here, if you have already progressed and you're in the more severe stage, this is not the drug for you, because it has been associated with worse clinical outcomes when it's been given to folks that have already had to be put in the hospital. So while this is another arrow in our quiver, it is not a knockout drug like I keep hoping for, but is one more tool that our clinical team has, and they're going to have to work on when and how to be able to give this to the patients that have the potential to have benefit and to avoid those that may have adverse reactions. On our vaccine front, I mentioned earlier the good news from the Pfizer. We have 4 vaccine trials underway in the United States. You'll remember these are randomized controlled trials, so the treatment team is blinded to whether an individual got the vaccine or whether they got placebo. If the treatment team is blinded, the company is for sure blinded. So the Pfizer executive speaking on Monday was, I think, relaying good news about the potential effectiveness, but they have not done all of the analyses on the trial going forward. And that's why this is just going to take us some time. On the next slide, the current status, the biotech Pfizer announced their preliminary results at 90% effective. That is a huge number. The bar that the FDA set out for approval was 51% effective. So a 90% effective vaccine would be a really great achievement. Johnson & Johnson and AstraZeneca that had paused theirs because of a individual with a severe illness, not known whether it was associated or not. As they looked at the data, they decided that it was safe to go forward. So those trials have been renewed, and Moderna continues its vaccine trial and recruitment going forward in the United States. Now, I think there are 3 questions that I would encourage you to keep in the back of your mind as we start to have information about vaccines. The Pfizer exec came out with the 90% effectiveness. So this is how effective is the vaccine into tricking your immune system to develop a resistance to the COVID-19 virus that it has never seen. So how effective is it? That's one important question. But there are 2 other questions that I think are equally important. What's the safety profile? Every vaccine has the potential for adverse reactions, and so we need to know what that safety profile is. And then importantly, and you haven't heard much discussion about this, is how long does the effectiveness last? If this is a vaccine that elicits effectiveness, but it only lasts 2 or 3 months, that's not going to be nearly as impactful as if it's a vaccine that causes a longer term immunity that gives us more time to be able to remain safe. We may need boosters over time, but these are the 3 questions that I would encourage you to listen for as we start to get results from our vaccine trials. Let's go to the next slide. Some new information about pregnant women, and this is different than we have talked about before. They looked at 400,000 women who were symptomatic with COVID. So they had become infected and they were in the 50 to 60% who had symptoms. They were more likely to be admitted to the intensive care unit, placed on ventilators, and unfortunately succumb than non-pregnant women. So I think pregnant women join that list of conditions that are associated with bad outcomes, and we should, emphasize efforts to protect pregnant women and their families who could convey the virus to them. So this is new and concerning information around pregnancy. Want to give you an update on a study that was just out of Vanderbilt last week that shows the effectiveness of masks. And again, that continues to be our best strategy. Our individual actions around masks, around businesses requiring masks, around us consistently using masks, even when we're around friends or family that we let our guard down. Tennessee, unlike Arkansas, each individual county has a health department. And so unlike Arkansas that has a centralized health department, and when the governor and Secretary Smith, now Secretary Romero, put out an edict, everybody has to follow that in Arkansas. In Tennessee, each county has its own health department and they make their own decisions. So if you think about the 80 plus counties in Tennessee, I can't remember, it's around 80. Each county made its own decision. So you have about 50% that have a mask mandate and about 50% that do not have a mask mandate. So the Vanderbilt team looked at hospitalizations, the number of growth in hospitalizations since July 1st for hospitals in Tennessee based upon where they drew their patients from. So in hospitals, Tennessee hospitals, where less than 25% of the patients that they admitted came from a county with a mask requirement, you see the almost 300% increase in hospitalizations during the month of October. I mean, it just spiked through the roof. If we go to the next 3 slides shortly, so here's 25 to 50%, you see less of a spike, 50 to 75%, the next slide, it's just barely up. And if you draw from a county where over 75% had an effective mask mandate, you had no more hospitalizations in October than you had in July 1st. So this just again goes to show that if we could get everybody to wear a mask, we would solve this issue very quickly. We might not get past it, but we would avoid what Utah is experiencing and what El Paso is experiencing. And I think we are unfortunately on a path where in some parts of our state, we're going to have some real pain in the coming weeks to months. So let me conclude. I think the next slide is thinking about Thanksgiving. I do want to emphasize, I think we touched on this last time, we've got a vaccine, at least one in the pipeline, others that will come online. This may be the holiday season that we need to try to do something different and just accept that the risk, particularly if you have family members that have any of those conditions, is just too great to come together. If you are going to come together, I think there are 4 or 5 steps that I would highly recommend now to put out. This weekend, this week, have a conversation with everybody who may come together and have people recognize that this is a risk, that by your coming together, you're placing your loved ones at risk, and that you all have to collectively be responsible to minimize that risk. And I've got family members, I've got folks working here with me. We've been pushing on this internal to our center, and it is a cause for tension. Some family units, they don't believe this is real. They thought it was going to go away last Wednesday, and it didn't go away. It's a tough conversation to have, but it's an important one to have. If you're going to bring people together, I think this weekend you start behaving like we were last April. You minimize your external exposure. You're going to the grocery store only once a week. You're not going to bars or restaurants. You're not eating out. Anybody who's coming together, you really need to minimize your exposure. Late next week, the week before Thanksgiving, Thursday or Friday, or maybe even the Monday of Thanksgiving week, people who are coming together need to go get a COVID test and make sure that you're not infected and asymptomatically carrying the virus and potentially spreading it to others. And then finally, if you're going to come together, ventilation is really the most important thing. If the weather is nice, do it outside. If the weather is not so amenable, then if you're inside, you really need to try to have small groups. You need to have the windows open, no matter how cold it is, turn the heat up. Turn your exhaust fan on the stove on so that you get some negative pressure inside of the house. It's interesting, I was studying earlier this week. Our houses, we actually have worked hard to have minimal air penetration. You don't want a porous house. That's why we have, double windows. We've got insulation. Houses don't exchange air very much. Conversely, our work sites, there are mechanical ventilation requirements. If you are in a nail salon, for every person in the air salon, they change 20 cubic feet of air every minute. Okay, so think about that. In a nail salon, the requirement is 20 cubic feet per minute. In a barber shop, it's 10 cubic feet per minute. Most commercial buildings, it's 5 cubic feet per minute. So the air changes 15, 20 times, every couple, 3 hours. And our houses, we built it so the air doesn't exchange so that we can be energy efficient. So if we're going to have Thanksgiving together, we have to break that apart. We need to open the windows. We need to get ventilation going. And you need to try to dilute the possibility that a virus is in that enclosed space with you and your loved ones. So with that, Tim, let me close out. Be glad to take questions. A little bit of light at the end of the tunnel, but we've got some dark days ahead of us. And I hope we can avoid the stress that Utah and South Texas is going through now, although most of our indicators are going in the wrong direction.
Well, thank you, Dr. Joe. Your knowledge and the way you communicated is just exceptional. I appreciate all the due diligence you all do, you and your firm, ACHI, all the people there. And after the questions, I'd like to ask you to share a little more about Kathy's award before we move to any other topics. So questions. Take him deep.
Dr. Thompson, I have a question. Given the fact that there appears to be pretty good mask compliance up here in Northwest Arkansas, how would you handicap the risk of, say, going into retail environments right now? Should us old people be getting curbside pickup? Or
I think curbside pickup actually was, I don't know if it was omniscient or premonition. It was, I think you should be doing curbside pickup if you can. I don't think there's this is logic, not science, but you don't know who in that retail establishment may be infected and potentially spreading it. I think I would recommend anyone, but particularly those that have a risk factor or those that are in the older age group, I would shop early. This goes back to what we talked about in the spring. The stores are cleaning at night, so they're the cleanest first thing in the morning. The crowds are less first thing in the morning. If you can do curbside pickup, I would do that, particularly for, you may have to go in to hand pick something, but you don't have to stroll around the whole store. If you can get the dog food at curbside pickup and the toilet paper at curbside pickup, let them carry it to your car and put it in there. Don't take risk that you don't have to take. This is an invisible threat. It's pretty clear to me that it is everywhere in our state and in our communities. And this is about using logic here to try to minimize your exposure and safeguard you and your family and your loved ones.
And that Ed, I don't think that was a setup question for James Farmer, but James is on the call with us, and James could unmute his mic and tell us a little about another alternative to get things. He's the founder of Easy Bins. I don't know if y'all have heard about Easy Bins, but tell us about it, James, and how that might be an alternative.
Yeah, so with Easy Bins, we teach our drivers and our people here that they're Batman, not Superman, which plays really well into the COVID experience right now, because everything goes well according to plan, you never meet us because our delivery drivers typically drop off things around between 3 and 5 o'clock in the morning. So our customers order late in the evening, and then they they never meet us at all. So that certainly has been a boom for our business. Absolutely.
And the range of product that you can deliver would be what, James?
We carry about 150,000 SKUs in each one of the markets we operate in. It's a little bit different per market. We're in Arkansas, Oklahoma, and Colorado. But like in Central Arkansas, there's probably about 100,000 SKUs from anywhere from Whole Foods to Aldi. Well, there's not Aldi there, but Whole Foods, Trader Joe's, Sprouts, Walmart, Kroger. And then we'll do specials and stuff. We run promotions. It's the food business. You got to promote it. But we see a lot more customers coming in. So one of the things that was never on our roadmap, and then I'll be quiet, or never in our customer base was the elderly population. And we actually have a market down in Arkadelphia. We have an operations center down there. And the number of people that use us from the elderly population was never part of our strategy at all. But I would say it makes up probably 45% of our customer base in Arkadelphia, and a larger percent of the customer base here. Like we never planned to go to Butterfield Village in Northwest Arkansas, but we do a lot of volume over there because it's a really simple, frictionless way to get groceries.
Mm-hmm. Yeah, it's a great business model, and James is a great leader for it. So,
if I could add, Tim, let me add on to the comments I made, having a second of thought with James talking.
Yes, sir.
I also would caution folks in your dining experiences. This ventilation thing is real. And in those dining establishments that folks are now returning to that don't have the ability to have windows open or have outdoor seating, I think I would encourage folks to think about using the carryout mechanism or the delivery mechanism from those restaurants, because I think this ventilation piece is going to turn out to be a real issue as we learn more about this virus. I mean, the 6 feet of space, I mean, that was logic, not science. And 6 feet is fine unless there's a wind blowing a good direction. Then it becomes 12 feet on one side and 2 feet on the other. So I think this ventilation piece is something for everybody to be thinking about and to think through in your daily activities where you are potentially in a space where restrictions on ventilation could increase your risk. And I think dining is one of those, as well as some of the other shopping experiences.
Also a great time just to eat at home. And like we started Easy Bins because research shows that families are resilient when they eat at home. It doesn't have to be fancy. If you just put a family around a dinner table, good things happen. Literacy rates go up, obesity rates go down. And so there's actually a great opportunity as a family, and as a household, whatever that looks like, to sit around, and it can be hot dogs and bread and chips and cheese. It doesn't have to be fancy, or it could be grilled chicken and rice. And so we've seen a lot more of that because we push a lot of recipes from influencers in different communities. And we've seen our recipe sales go like this since COVID. Because people are just using their hands. It's a very tactile, like in terms of just like a healthy activity for a human, cooking's a really healthy activity for us. It engages all the senses. We're doing something for somebody else. We as a company love the concept of cooking.
Yes.
And so we try to push it really hard, and COVID has been kind of a nice tailwind to help push it in a positive way.
And James, easybins.com is how you reach you?
Easybins.com.
Okay. Thank you very much, James. Glad you're here. Other questions for Dr. Thompson, please.
Hey, well, can I ask one question?
Kathy, you want to say something? Kathy, you're muted. Do you want to say something?
Go ahead and finish, James, if you've got another question.
I was just going to ask Dr. Joe a question. So sanitization practices have become a really big deal for us. We have a cold chain, but then through the entire supply chain. And one of the things that popped onto our radar from one of our vendors the other day was UV light. I'm not UV light, ozone. And using like ozonation, because think about big spaces. We have to sterilize we have to disinfect, we don't sterilize them, but disinfect all of our surfaces. I just want to know what your thoughts are on like ozone, if that's a practical solution, or if it's something we should look further in or steer away from.
So a lot of the sterilization techniques that have been, I'll say, advertised or marketed, do work for bacteria. And so, I think you got to remember, this is a virus. So this is not really a living entity until it infects a human cell. So a lot of the things that work for bacteria are not going to work for viruses. I don't know about ozone specifically. I can try to take a look at that. I do know that, common disinfectants, this is a respiratory virus, so it's going to settle because of gravity. And so that's why, back to going to the store in the morning as opposed to the evening, it's been cleaned overnight, and hopefully the checkout counters have been wiped down. And so that's been an antiseptic effect there. I'll have to look at ozone to see whether it does have a killing effect, or at least a neutralizing effect on the virus.
Thank you. Thanks for the question, James. Kathy?
I've got two questions. First is, do you think the governor is any closer to making a move toward massive mass use instead of just encouragement? That would make such a difference.
Kathy, I think a lot of voices are trying to amplify your question of the governor.
Good.
In my observation, I think the governor has had concerns about really twofold. One is his ability to enforce a mask mandate. I don't know that there's a police system out here that's going to, really enforce it. And second, and this is candid, I think he has concerns about his political power and coming into a legislative session where a large number of the more rural legislators, are not supportive of a mask mandate. In fact, you may recall he got sued, or the Secretary of Health got sued by the new senator up in Jonesboro to terminate the emergency authority of the health department and the governor. So I think those two issues have our governor more reticent to actually use the bully pulpit that he has. I do think, and I am going to add, continue to have my voice as loud as I can make it. He needs to use that bully pulpit as the leader of the state to say masks need to be used everywhere, and not kind of be more reticent about that. I think Northeast Arkansas is a prime example. For the last 2 weeks, you've had all 11 hospital CEOs up there sounding the alarm bells that they are in trouble. And yeah, the rest of the state can help them for a little bit until the rest of the state gets in trouble. And then we're all going to be in a sinking ship. And I think the time is now. I think the governor is going to be forced to consider what I would call a pause, where at some point in late November or December, we go to where we're going to say we're going to try to cease public activities for a few days to break the exponential spread of this virus. It is spreading exponentially. So unless we end up putting something in place that stops that exponential spread, we're going to be back to where we were and where we saw New York last spring. And I hate to say that, but all the numbers are pointing in that direction.
Yeah.
I agree.
Yes. You had another question, didn't you, Kathy?
I have another question. We saw the effects of just the news that Pfizer is saying that their vaccine is 90% effective. I also caught a short bit of news saying that that was based on 7 days. My concern is that the public is so anxious to get out of this. I was talking with someone this morning who said, well, I think in 9 months to maybe a year and a couple of months, we'll be free of all this. And I'm real concerned about everybody's anticipation not being real based on the effectiveness of this vaccine, which has been rushed so quickly. never before have we ever had anything like that happen.
Right. Well, there's nobody who's more tired of this than I am. I'll just put that out there right now.
Yeah.
And I think, I think a couple, three things. One is the College of Public Health is going to put out their study today, and it shows that the receptivity of the Arkansas citizens to even take the vaccine is very low. I mean, less than 50% of Arkansans say they would even think about taking the vaccine. So if we don't get the vaccine delivered, then we're not going to have the protection that the vaccine offers. And then to your point, and that's why I kind of raised those three questions, it may be effective, but we don't know about duration until we let time pass and know how long that effectiveness is going to last. Even though we've rushed the development, you can't rush time to know how long it's going to stick around. We're going to have to learn with that over time. And I just don't think some of the conversations that are occurring, they're at least not complete. And I would rather have a complete conversation that lets people honestly assess where we are so that they can take actions that we know work, but that if we have a false sense that somehow there's going to be a magic bullet right around the corner, we may let our guard down.
Yeah. Good questions, Kathy. Thank you. Other questions? Keith?
Dr. Thompson, I think James Farmer's question around ozone is an interesting one. If you're looking, or maybe you already have a perspective about UVC lighting and its impact in HVAC systems.
Yeah, let me do this for the group. I'll try to do a little work and get a summary of what is known about what is effective against COVID-19. I don't want to misspeak here, and I need to do my background homework here before I give you an answer.
Okay, that's very prudent. Thank you.
Thank you.
And what about, I was talking to my friend of mine in San Francisco, Michael Skinner, and they're of the belief that vitamin D is a big important. What's your view of that?
Yeah, I think any of our multivitamins, any of our individual vitamins are not going to be harmful. So this is back kind of to logic. They're not going to be harmful, but I don't think that they're going to offer you any protection if you get a significant exposure and come down with the virus.
Yeah. Okay. Other questions, please. Okay, so Dr. Joe, we appreciate your time and all your energy. And can you tell a little more eloquently the award that Kathy Grisham got before we, and the gentleman named after him?
So on the 30th of October, we had the opportunity to have a virtual soiree. That was the first time I've ever had that many people on a Zoom call at one time. And luckily we didn't have any Zoom bombers drop in on us or anything like that. But had the opportunity to give both Kathy in your presence and also Dr. Jim Zinni of Mountain Home, the Dr. Tom Bruce Arkansas Health Impact Award. Some of you may remember Dr. Bruce. He was Dean of the College of Medicine, and then he went up to the Kellogg Foundation, and when he came back, he ended up being the founding Dean of the College of Public Health and also the founding Dean of the Clinton School of Public Service. But he had a lifetime commitment for making sure that there was high quality health care in rural parts of our state and of America, and also to make sure that individuals that were disenfranchised, low income communities, communities of color, were taken care of. And so our board about 7 years ago established the Arkansas, Dr. Tom Bruce Arkansas Health Impact Award to have kind of the Public Health Hall of Fame, and your Kathy Grisham was added to that list at the end of October. Others on that list include Dr. Joe Bates, Dr. Joycelyn Elders, Ben Owens, who helped build the Jonesboro healthcare system up in Northeast Arkansas. And so we're honored to be able to give Kathy that award on behalf of our board.
Thank you. Public Health Hall of Fame. How about that? Can we have a little round of applause for Kathy? She's turning red, I think. I'll tell you, she was in a CEO forum with us for many years, and you know, just the hard work she did and how much she cared about it. And, you know, there's a period where she didn't know where her funding was going to come from, and just dealing with all the headaches of growing to all for, you know, the underserved. And 200, almost 300 people help serve the underserved, thanks to Kathy and the team she built. And she left it in good hands. So she's successfully retired and getting awards these days, huh? Kathy, it's fun, isn't it? All right. Anything else y'all want to talk about before we wrap up? Sterling?
Yeah, Dr. Joe, that report from the College of Medicine, I received it this morning. I've been looking at it, and fortunately, I'm able to get this every couple of weeks. And I've noticed first thing I go to is the long-term projection of cases, when it's going to peak and so forth. And it looks like it's still going to peak somewhere around April 1st. The median active cases shows to be 35,000 active cases, and going maybe as possibly even as high as 60,000 active cases. Now, that active cases they're happening right now, that's not cumulative. Considering the fact that we've got, 2,000 active cases now?
Right.
Those are really scary numbers.
Yeah, go ahead, sir. Yeah.
Well, it's just, do you think that those are undiagnosed and diagnosed numbers?
I think those are undiagnosed and diagnosed numbers, or those are total numbers of infection. I got a copy of it as you did this morning. I hadn't gone through all of it. I think those are total infections. I do think, you know, and just doing the math, if we've got 2,000 active cases now, and we've got 780 folks hospitalized, you can do the math there, and it doesn't look very pretty on the hospital side if you got up to 30,000 active cases. And that's really where I think a cause for concern is. But you're right, the peak is late, you know, it's several months from now, and it's at a much higher level.
It seems to me, I mean, it seems like a no-brainer that the governor just needs to shut down the bars and restaurants, if nothing else. There's so many people up here at the university that are just going about their business like nothing's going on. And it just seems like that's such an easy thing to do. Now, that goes back to Kathy's, you know, observation about, you know, mass mandates, but, you know, taking it one step further. I'm just throwing that out there for your thoughts.
Well, you know, I think the governor's in a tough situation, but he's going to get in a tougher situation here the longer that we don't take action to actually break the cycle. This thing is not going to disappear. It's not going to get better as we spend more and more time inside, you know, as cold weather hits. I think we're seeing this week, late last week, the effects probably of gatherings around Halloween. We're going to have more gatherings around Thanksgiving. And this thing is going in the wrong direction.
Yeah, those are big numbers, aren't they, Sterling?
Oh, just eye-popping.
Yeah. Okay. Other questions?
I'll also add, and this is, I don't want to be too critical because I understand they're in a tough position too, but a hospital CEO is one of the last people to say, I have a problem. And if I've got 11 hospitals together up in Northeast Arkansas saying we have a problem, this is real. And you know, Utah, the governor making a decision that we are now not going to offer ventilators to some people based upon age or health. That is not where we want to get to.
Yes. And does everyone get the information from Martine Pollard on that's the representation from all the healthcare professionals she does? It's a beautiful piece. I mean, it's detailed, well done, and they're taking it seriously. Obviously, if you don't have that, she's with Mercy, and we'll help you get it on the list if you'll send us an email or contact us. Martine Pollard, a great one. All right, any other questions? Hopefully there's some restaurants that are doing this right, Sterling. I think Bordino's are being so disciplined, but I'm sure the others are a little more lax. And again, I don't know about the air. We need that air like the cigar store has. I think, you know, what was it? The guy, the cigar guy, Brian, in case he's on, think he said his air circulates every 7 seconds or something like that. I don't know. I calculated that, but so maybe we go eat at the cigar store if you're going to eat. I don't know. But anyway.
Sounds like a plan.
You like it, Stuart? Yeah. All right. Other questions? Anything else y'all want to discuss? Anything come to mind? Anything, any topic can
I'll
be
just
put.
volunteer, Tim. I'm Amanda.
Yeah.
I'm doing some work for the Arkansas Hospitality Association, trying to investigate how hospitality can continue to flourish, would be kind of a strong word, just survive in the industry with COVID. And David Stobaugh of Stoby's Restaurants statewide was relaying to me that he thought that drive-through service from sit-down restaurants is going to be the way to go.
Yeah, it's going to be a big piece of it.
He said that his restaurants already have that option pre-COVID, and that he felt like that really gave him a major advantage. So that's another option other than just closing down bars and restaurants, to make everything maybe go just exclusively pick up drive-through again.
Yeah, maybe we can have like Louisiana, you can get drive-through drinks, right?
Because yeah, well, and here too, I suppose, in Fayetteville at least. But that's just, it's keeping in mind that hospitality industry as we try to make these strategic plans.
Yeah, very good point. Yeah, I think that's right. The fine dining, and hopefully we can participate in that by doing some takeout. So we have those institutional kind of players on the other side. All right, it's still got a long way to go. Jody,
can I ask one question? This happened yesterday, and it did cross my mind. And you mentioned, the 6 feet is logic, not science. And if the wind is blowing, it might be 2 feet on one side and 12 on the other. So yesterday, as I stepped out the front door to take my little puppy out for her afternoon walk, the 2 older ladies in my neighborhood who walk together every day were leaving for their walk, and they invited me to join them. And we did walk a good 6 to 8 feet apart. We were kind of walking down the street, in the middle of the street. But the wind was really blowing yesterday. And I was concerned. I have not had much of any exposure, but my husband goes to work in construction every day, and who knows what he's bringing home. And I was just very aware of all that and thought to myself, should all 3 of us be wearing a mask outdoors as we walk together? I know it couldn't hurt. It would probably help a lot, but how necessary is that?
I always get the tough question right at the end. Where's my friend that always asks the easy questions up front at the beginning?
Yeah.
Jody, I think you're being logical, and I want to encourage that. If you wanted to optimize your safety, y'all would be wearing a mask outside. I think there is, not any strong evidence that, if you're truly 6 to 8 feet apart and you're outside and you got good circulation, that is a high risk situation. We do know that, this is a respiratory virus. So whenever you get your respirations up, or, if y'all are truly walking fast and breathing hard, if one of you was infected, the transmission potential goes up. But I don't think right now masks, if you're appropriately distanced outside, are a requirement. I've not seen that. I think it really is when you're in close proximity to individuals that, if you think about, if you go through your day, your husband goes through his day, every person he comes in contact with however many more people. And it doesn't take but one spark to get the fire started, and then you got a forest fire underway. So I think your risk is probably much less from, your walk with your 2 neighbors at a distance space outside than probably some of the other activities, even going to the grocery store twice in a week as opposed to once in a week.
Yeah.
Thank you.
I had Gabriel Machado brought some food over Sunday night, and he delivered it, and I didn't have a mask on. He did. He's Rockline. They're very conservative. And then I thought, I need to get, I was close. I wasn't really close to him, but we were talking, and extended talk, and I was out in my garage outside, but I thought I got to get a mask on because we're talking too much,
I do think, Tim, that is a real I mean, you're comfortable, it's your friend or your family member, and you don't see them as a risk, but they may be a risk and not know it because they may be asymptomatically spreading the virus.
Yeah.
And I'm increasingly hearing people that know people who had, a couple over for dinner. So it was just the 4 of them at dinner, but one of the 4 had it, and then all of the 4 have it. So
Yeah.
it is important not to have prejudices about who might be or might not be infected. Everybody might be infected.
Yeah, yeah. And just having that awareness, and we talked for 30, 40 minutes with masks on, didn't bother us. We couldn't always understand each other, but that's part of it. But all right, Jody, that's a great question. All right, we appreciate you all. Stay safe, and congratulations again, Kathy Grisham, Public Health Hall of Fame. How about that?
Congratulations.
Yeah, thank you all, and share all this information that Joe gave us, and we'll put it on YouTube, and we probably we'll try to prepare a little one-pager on Thanksgiving best practices from ACHI to distribute. Okay. All right. Thank you all.
That'd be awesome. Thanks, Dr. Joe.
Thank you. Have a good day.
Thanks, Dr. Joe. Thanks, everybody.